Hi, my name is Robin, and this is Sheila.
Hello.
Sheila's been going through my breast cancer journey with me. She's been with me since day one, and we're just going to talk for a few minutes.
Robin, you had an appointment. Can you tell us about the appointment that talked about your expanders?
I went to the doctor on Monday to the plastic surgeon for a release so I could start my chemo today. And I have expanders in, waiting for my reconstruction, which will be done after all of my treatment's done. So she gave me an expander to show. This is what an expander looks like. It's it's placed in your breast after they take all the breast tissue out, and then they start filling it. There's a port in here, and they start filling it with normal saline. It stays in place until your reconstruction is done.
How do expanders feel, Robin?
Expanders are extremely uncomfortable. I could feel, this feels soft now, but in me it feels hard. I can't lay on it. The only thing that's making me want to keep them is I'm keeping in mind that it's a step towards a process. It's the end that I'm looking forward to. If I lose the expanders or take them out when I get my tummy tuck and they take the fat out of my abdomen, they're going to have to use my abdominal skin. And I'd really rather just use my breast skin.
Do you need any pain medication for it?
I'm trying not to take pain medication. I've been having an electrical shock kind of pain go through my breast, and the doctor says it's my nerves regenerating, and she wants me to take some pain medicine. I have a problem taking lots of medicine, so I'm trying to talk myself into taking it.
And what would you say to other women who are going through this process, that it is a process and then there's a, end to it?
If you decide you're going to have reconstruction with expanders, to remember that you're not going to like it. You will not like it, but it's a step to an end. And if you keep that in mind, I think you could make it through it.
Oh, thanks. Robin, let's talk about your first session with chemo today. Tell me about your feelings.
Well, I've been waiting for this chemo to get started. I've found that the worst part of having cancer seems to be the waiting for the next step to happen. It seems like the waiting is takes forever. I've been waiting for this chemo to come up, so I went Monday and had a dental appointment and had my teeth cleaned. They say you should have that done before you start chemo because you can't have any dental work during chemo because of the bacteria in your mouth, and they don't want any infections to arise during chemo. I had that done. Yesterday I went and had my blood work done. Each day before a chemo session I'll have to have blood work done to make sure my white blood cells and red blood cells are all, I'm okay, I'm not too anemic. And today I went in. I thought I was really prepared. Let's get this started. The sooner I get it started, the sooner it's done. But I found that at like 2 o'clock this morning, I was wide awake. I could not sleep at all. I just kept thinking of this chemo going through my body and it's killing off everything. And I was worried. I was like, I can't do it. I'm not going to be able to do it. And those were the thoughts I had. And it wasn't until I got to the hospital that it started feeling better. A little better. It was scary. Scarier than the mastectomy. So.
And what was your feel? What did you feel like doing the chemo session? What were your feelings, your thoughts? Once it actually got started.
I didn't feel anything. It was surprising. I was really afraid for them to access this port because the port, this port was never been accessed before. didn't know what it was going to feel like. I put a cream over it this morning, a numbing cream, Emla cream, and when they accessed it, they had me turn my head. I made them show me the needle before, so I knew what it was going to look like, and it looked kind of big.
Mm-hmm.
But I turned my head, and I felt nothing, and they got an immediate blood return, so it was fine. The pre-meds were 2 antiemetics, which are medications that help you not feel sick. One is called Zofran, and then the other one was called something Emend. The Zofran works quickly, the Emend works over 3 days. And then I got a steroid. I don't remember what the steroid did.
Yeah.
I didn't retain what that was, but it was dexamethasone.
Right.
1 dose of that.
Mm-hmm.
I didn't feel anything with them.
Mm-hmm.
And then I had to get the infusion of the actual medicine. 2 meds together. One was called adriamycin, and the other one was cyclo something benzamide. I don't know.
Yeah.
I think it's cytotan or something. It's short. The adriamycin is more toxic, I believe. It's red. It was a pretty red color, and it's turning my urine red. That's the one that will make me sick if either of them are going to. That's the one that could cause a heart problem. So remember, I said I had to have echocardiogram before I started the medication, and I'll have to have one again after. It took a few hours. I had to be at the doctor by 9, and we left at 2:30, I think, today.
Mm-hmm.
I got to drink, and we got to eat, and fell asleep for a little while, and it was really uneventful. I do have a little device on me that's going to give me some medication tomorrow. Chemotherapy kills all fast-dividing cells. Cancer cells are fast-growing, but so are hair cells and your white blood cells and your red blood cells. So it kills everything. So this medication is going to help boost my white blood cell to reproduce, so that I won't be so prone to infections. It's an automated device that they actually put it on my stomach, and it's going to auto inject tomorrow, like 25 to 26 hours after my chemo. We'll see how that feels.
So tell me, how are you feeling now? You had a whole day of chemo. How are you feeling? How are you actually feeling? Were you able to eat something, continue to drink fluids? What?
I feel my regular self. I don't feel any different at all. I hope it continues like that. I don't know how I'll feel tomorrow. I'm just going to stay positive and hope it continues. I will have to start taking the medication for nausea tomorrow to try to ward it off.
And as I recall, one of the most important things to do was to drink plenty of fluids,
I'm
plenty
trying.
of water.
I have not been drinking.
Water. Right.
I have to drink 8 ounces every hour for the next few days, and I have to take a Claritin pill for the next 5 or 6 days, once a day, and that's to help with the bone pain. When I get the medication to make my white blood cells increase, white blood cells are produced in your bone marrow, and with the increase, it makes your bones hurt. And they say for some reason Claritin, which is an antihistamine, helps that bone pain. I don't think they really know why it helps so well, but
They didn't. They couldn't give us an definitive answer about that.
But it helps, so I'll take that.
Hi. Just to clarify, the steroid dexamethasone is used to treat nausea.